see a lot of people who say that 45 is not their president. He is my president, and that means I'm his boss. I see a lot of people who say that 45 is not their president. He is my president, and that means I'm his boss.
I'm Brenda Dare. I live in Pleasant Hills. I'm 44 years old. I was born with cerebral palsy. I also suffer from generalized anxiety disorder, depression, and arthritis. I was born in 1972 to a lower middle class family. I spent my first 36 days in the NICU, and I wasn't expected to make it through my first 36 hours. If lifetime caps on health insurance had been a thing at that time, I would never have seen sunshine before I became uninsurable. I will not see that happen to children born like me in my lifetime. Because the care services that I use are funded by state-only Medicaid dollars, because it's a buy-in program for people who work, I know that those services are going to be first on the chopping block as per capita caps are instituted and states are forced to make really hard choices about health care, because we live in a nation where the right to institutional care is still guaranteed, but we have to fight for services in our own homes and communities. Because of the thinking that existed when I was born and during my young years, my parents were advised that the best place for me was in an institution. And though they resisted for the first few years, at the age of 3.5, my parents reluctantly left me at the Home for Crippled Children in Pittsburgh so that I could get better, so that I could be more normal. What's normal? Institutional living rips families apart. I spent 7 years in those walls, and I was fortunate. I got good care from good-hearted people that helped me see there was a lot in my future if I was willing to fight for it. And believe me, nobody knows how to fight and do more with less than people with disabilities. I refuse to have that be my future. I work full-time. I supervise a staff of 6. As I grew up, I knew that I wanted to work to help other people with disabilities have good chances and good futures. I was lucky enough to land at a Center for Independent Living, and if you don't know what that is, see me and find out. I'm very, very proud of the work that I do on a day-to-day basis empowering other people with disabilities. I will not let my retirement years be dictated by a draconian healthcare policy that, just as I'm ready to sunset my career, leaves states with no option other than to warehouse people with disabilities like me. Every day, I rely on support services from home care workers to get me in and out of bed in the morning, to get me dressed, to get me showered, help me go to the bathroom, all those things that he takes for granted, all those things so many of our leaders take for granted. And without that care, I would find myself back in another institution. I'm going to leave you with one very important thought. This isn't health care, this is wealth care, and it's got to go. People not profit. People not profit. People not profit. People not profits. People not profits. People not profits. Thank you. Not profits.
Good day around the world, everybody. That was Brenda, who we obviously know she's a badass. Brenda's a badass. And there's been a lot of people like Brenda rising up around the United States and around the world to say no to what's going on with this. I think it's beyond an oligarchy at this point. Thank you all for being here today. Hey, Dennis. We have German number 2 with us. That's very nice. I also have the lovely Laura Livengood with me today. Laura, how are you doing? You're muted. That's all right.
Sorry, my neighbor was rolling his garbage can past my window earlier. I had to mute my microphone. Yes, it's 30 degrees cooler today than it was yesterday. I'm much happier.
Nice, nice. Doesn't your neighbor know we're going live with Bernie and they just need to be quiet? Just...
What can I say?
I know. The revolution stops for the neighbors. Milk,
Right.
chocolate, all sorts of stuff.
And Milo.
And Milo, definitely Milo. Who's doing much better, by the way. Only has a few days left of medicine.
Okay.
But and thank goodness Milo's care at the vet does not cost, although it was kind of expensive, $160 for one thing. But human care, a hell of a lot more expensive, as we all know. We've been hearing story after story. If you guys saw the West Virginia rally this morning, there were several just amazing testimonies from people who would be dead now if it weren't for Obamacare. Obamacare may not be great, but it is definitely, it brought 20 million plus people back, gave them health care, right? And gave them an option that they didn't have before. And you need to improve on it. That's the message. You can't gut it. You can't take it away. We have to improve on it. The Republicans have no interest in doing that. The establishment really has no interest in doing that because it will directly affect insurance companies. That's who loses. And here's the thing. Insurance companies aren't alive. So I'm okay with them dying. And it's going to mean some people probably going to have to find new jobs. But the benefit of that is that they're having to find new jobs because people are going to be alive. And I would think that they'd be willing to make that trade, to have to leave the insurance industry and watch the insurance industry dwindle down because other people were going to have lives. You'd be willing to make that trade on your moral compass. I don't know. Obamacare was a good start. Remember everybody, I don't know if you remember, but the Obamacare bill as it was originally written was great until the Republicans eviscerated it. They removed everything within it almost that made it awesome and turned it into meh, which was why everybody complained about it, because what they did was make sure there was enough profit built in for the insurance industry, right? Which really throttled the Obama. It really made it impossible for the bill to do as much as it was supposed to do because costs were still too high all around for everybody. What has to be done is a cap has to be put on greed. And in capitalist America, nobody wants to put a cap on the greed. It's kind of hypocritical. That's the socialist part. That's where the socialist part comes in. You know, I think the last 2 years we've learned that the word socialism is not a bad word. We've been told a narrative that it's a bad word. Hey, Laura, how you doing?
Hey, I'm good.
A lot of people in the audience today.
I know.
70 already.
People.
83.
Wow.
Shit, I'm going to look at the numbers. Hi, everybody.
Yeah.
We're hanging out here talking about the news and waiting until the rally starts. It's on Facebook at Bernie Sanders page on Facebook. And you guys welcome to go there or watch it here with us. This is just a hosted stream, and you know how we do these things. It's good to see you all in the chat there. Hey, Al and Rob, Melissa, Free Thinker, Ski Vermont, Mary Stanford. Wow, a bunch of people I haven't seen in a while. Ashley, I was just talking to you. We're working on a new show. You guys know who Sandy Blue Ocean is, or Sandy Chalice, Environmental Coffee House. She does a show on Facebook. We're talking with her and Judy and Kat, and the three of those, they're putting together a new show on climate. And that's kind of my favorite topic to talk about because I like habitable planets. I don't know about you. It's going to be cool. It is. I'm excited about it. It's going to be climate-wise.
Yeah.
All right. I notice we're still peeking out here. Sorry, guys. Adjusting the audio here. Things seem to be rather touchy today. Although for us, weather's not bad. How are you guys down in L.A.? I was looking at the stories of the heat wave. Is it cooled down? Anybody in L.A. there? Think about this.
Do we have any L.A. Southern California people, SoCal people? Anybody affected by the Whittier fire?
Yeah. And the many other fires that are happening in California right now that are not being reported on nationally.
There's a bunch.
L.A. concrete. I used to live in SoCal. I lived in Rialto, and we moved further west as we could afford to, which is the standard. You start far away from L.A. and move in if you can, or somewhere you're happy with. Anyway, move in. It was a 2.5, 3 hour drive into work when I worked into L.A. But the thing you notice is that it's mostly concrete. If there is land, it's dirt. If there's landscaping, it's properly maintained with a lot of water from a lot of sprinklers. There's even a landfill out there that actually does the opposite of what a landfill. It's the Puente Hills landfill. If you ever want to take a look at this, you'll never see another landfill like it in the area. It's off the 60 freeway, and they actually water it, which is stupid as all stupid. I used to be in the industry. They water it because the residents refuse to have a landfill that looked ugly in their neighborhoods, and so they put bushes and trees and stuff all over it. We'll do a whole nother show on landfills and how horrible they are and stupid they are, and the waste of energy that they are, but why you don't fill your landfill, which is a garbage bag full of nasty stuff, with more water, and then spend money to pump that water back out just to make the residents think they have a nice, pretty green hill. That's LA. Anyway, my point being, 163 degrees on the concrete on the 10 yesterday. That's hot. 101 in the shade. About 140-ish out of the shade, 160 on the baking concrete. Because LA is mostly concrete, metal, dirt, right? It's going to be interesting for you guys down there.
At least it was a dry heat.
Was it dry? Is it?
Yeah.
That's nice.
Yeah, at least, it was only 18% humidity here yesterday when it was over 100 degrees.
Ooh,
so.
Okay, yeah. You're right, the dry makes it better.
It does. You could be cool in the shade.
Yeah.
In theory, anyway.
Yes. No way. Well, so they started early last time. We were coming on, we were just about ready to go live, Laura and I was like, holy shit, they're running. Not this time. Bernie's on his way, right, or talking to the crowd outside. So we're just going to run this. This is another clip. This is interesting. This is a group of people that did a sit-in at... I don't even know what congressperson this is who was afraid to be there and talk with his bosses. But this is another one of those, situations where people go to voice their opinion and say, we don't take away our health care. What's interesting about this is the police start asking questions. There's a conversation that actually happens, which I thought was amazing, that the police have a conversation with them at all, which is great. And then the police listen. I mean, listen, these are the kinds of exchanges I would love to see happen all the time in our community between our police and our citizens. Right?
Rather go to jail than die without Medicaid. Rather go to jail than to die without Medicaid. Rather go to jail than to die without Medicaid. Rather go to jail than to die without Medicaid. Rather go to jail. Senator Gardner, shame on you. Senator Gardner, shame on you.
Don't you guys think you'd be more effective protesting outside?
No, we're good. We're right here. Alright, y'all. We're not going to engage with that kind of garbage.
So nobody wants to take this outside?
They're going to carry us home?
I didn't know they were going to get rid of Medicaid. I didn't know
Yeah, you get one that affects everybody. Can affect you.
God forbid you get shot on the job or something and you're disabled. Will the cops take care of you for the rest of your life?
I don't know.
Or would you need Medicaid or something?
I don't know.
See, that's the scary part. You don't know, do you? I'd be asking because in your line of work, even walking across the street, anything can happen.
Instead of protesting, screaming, tell me about it. I don't even understand.
So who would get cut off by the bill?
All of us.
Everyone here. Everyone you see.
Everyone you see.
22
And we all work.
people like in a year.
You guys done. We want Senator Gardner to commit to vote no. Without Medicaid, I could not live in the community. I could not parent my children. I could not go to work. This is not a rollback of the ACA. This takes us back 50 years. We're going to be here until Senator Gardner agrees to vote no on this anti-healthcare bill.
Rather go to jail than die without Medicaid. Rather go to jail than to die without Medicaid.
There's so many wonderful people in the house. We thank you for your safety, safe travels here, and we hope
here it is,
when
live.
you leave this place, you will reach your destination without any hurt, harm, or danger. Let us all bow our heads. Father, we thank you for this great aggregation of wonderful people who have come, oh God, tonight to say a word about one of the most important bills that we've had to face in our lifetimes. Not since, oh God, since 2000 that we've had to face this kind of situation that we're in now. But we welcome everything that we will be doing tonight, everything that we'll be saying tonight, and we're going to give you all of the glory. I just want to thank you because not since 1964 and 65 have we had such an important thing to be addressing as we now address the ACA and the other bills that have been postulated. And now we ask that you would be with us all, bless all of the speakers who will come before you, and we are so great that they have made it safely as well. We ask it all in your Son's name, and for his precious sake we pray. Let us all say amen. Amen. Good evening again. I'm so glad to be here. Amen. Amen. Everybody asked me, say, "Oh, you from Cincinnati, right?" And I said, "Yes, I'm from Cincinnati, but I'm also from Covington and also from Newport. I'm from this region, and we just thank God for all of us as we come tonight." I want to say that my appeal to you tonight is that we don't need to replace or repeal the ACA. We need to, if anything, to fix and innovate the ACA, not kill and replace. As I look over this country and travel across the world, just got back from Dubai, and everybody in Dubai has insurance, and I've been to other places and they got insurance. Why not in America that everybody has insurance? We are an exceptional people. We have been known to be an exceptional state, an exceptional country. The Frenchmen of old said about us in America that America is great because America is good. And when America ceases to be good, it will cease to be great. And I'm telling you, amen. And so tonight, we want to see America regain that good reputation that the Frenchmen said that we had since we were here since 1619. America is not a place where they would love to see people going to bed and not only hungry but sick and can't get well, can't pay for prescriptions and have to eat cat food and dog food because medicine is too high. That's not what America is about. If other countries can do it, so can America. What do you say about that? There are plenty of people in this country who are Medicare and Medicaid experts who have told me personally that, Damon, it can be fixed with no problem if the two parties would just get together and put their egos behind them and just work together, and we can get this done with no sweat. I believe that can be done. I want to congratulate Kentucky for what they did with Medicaid and Medicare and everything. The governor, Beshear, stepped up to the plate, had the courage and the tenacity to do what is right. I want to thank him. And now, I don't want to get too political tonight because I'm a man of the cloth, and I just want you to know that God does not like ugly, and a lot of things that are being done is not too pretty, and we want to make sure that we restore the good reputation of Kentucky and all of the rest of our states. I look at Ohio. We're having a Narcan drug problem. Boys and girls are falling out on the street, ODing, with little babies in the back seat of the cars. That's not the way we want our kids to be growing up and riding down our highways. It's a dangerous thing. And I also want you to know that our senator and also the senator from Pennsylvania, Brother Toomey, they're doing some good things, trying to get this bill together so that the drug situation will be included, and those who are on drugs who need to get the medicine to hopefully get them off and get them restored again is going to be available. I think that's a great idea, a great thing. So I have come tonight to say that I am optimistic that we're going to get it done, because if we can take people to the moon, if we can go all around and circle the globe, if we can go to the depths of the sea, then we can definitely get this health care fixed. Can I get a witness tonight? I watched you as you were coming in, and I didn't know the crowd was going to be so large. I came through the back door, and when I walked in here and I saw all of you, I said, boy, God is blessing us here in Kentucky today, and He is a great God. So I want to tell you to keep doing what you're doing. Keep opening your mouth. Don't shut up. Don't let them silence you, because if you see something, you got to say something. And if you don't... Amen. We have to say something when it's not right. And if you say something, if you see something, you got to say something, because a whole lot of folk, they don't say anything, because once you say something, sometimes you might have to suffer something. But we are not ashamed to suffer for the cause of goodness and for the cause of right. So And so I congratulate you tonight. They gave me 5 minutes, and I think my time is about up. And I don't want to hear the bell ringing in my ear. So I'm going to quit now and just say thank you for being here. And we are all in this together, and the Lord will see us through. Let's give God some praise in the house tonight. God bless you and God keep you.
Ladies and gentlemen, please welcome Charlotte Wethington.
My name is Charlotte Wethington, and I'm Casey's mom. The mom of a young man who lost his battle with the disease of addiction and died of a heroin overdose. Not this year, not last year, not 5 years ago, 15 years ago. It will be 15 years ago that we became acquainted with heroin when it came to our house and took our son. It took Casey's brain, it took his spirit, and it took his life. And it didn't stop until it took it all. It was an addiction like no other. Other drugs he could pick up and put down, but not heroin. Little did he realize when it was that he had crossed the line into heroin addiction. When we finally realized to some extent how sick he was, it was the beginning of the end. We didn't have a clue what to do to help our son when he was the sickest he had ever been. I thought the best thing to do would be to go to my doctor. That's what I'd always done before. So reaching out to my physician for help, I was wished good luck. Lay and professional people alike told us that Casey had to want to, lose enough, and hit bottom before he could recover. 2 overdoses were not bottom enough. Since he said he was not trying to commit suicide, he was released without treatment. He was told that he hadn't lost enough yet. Being arrested with the threat of jail time was not enough either. Instead of being held to protect him from himself, he was released on his own recognizance with the warning of a summons in 90 days. A person who is addicted like Casey might not have 90 days. They might not have 90 minutes. It took a 3rd overdose for Casey to hit his bottom, the kind of bottom from which you do not recover. Because here's what I say about bottom now. The bottom line is this: people have to be alive to recover. After continually being told he hadn't lost enough, we lost everything. On August the 19th, 2002, we were out of options. 10 days after an irreversible coma, we let Casey go. Casey failed to receive treatment after the first 2 overdoses, and the summons that could have offered the hope of help arrived the day of his funeral. Casey died from a treatable disease. Casey's story will be the story of other Caseys with the proposed cuts to health care. As a recovery advocate, my focus has been on helping families intervene with the use of Casey's Law and by assisting in finding treatment. The passage of the ACA has helped turn hopeless situations for families into hopeful options for their loved ones. The many calls I receive begin with, "My son, daughter, mother," you fill in the blank with a loved one's name, "is going to die. I need help and I don't have any money." When those calls come in, my first question is, has your loved one signed up for health care coverage? Why care? Because it provides the opportunity for people to receive medical attention for health issues that in the past have gone untreated due to the lack of insurance, leaving our unequipped and overwhelmed ERs to provide general health care. Why care? Because it helps people access medication-assisted treatment. The best evidence-based treatments for opioid addictions include the use of certain medications with other therapies. Without insurance, these medications are cost prohibitive, and without these medications, the fact is too many people die. The expansion of Medicaid, along with the inclusion of substance use treatment as an additional health care benefit, has resulted in more treatment beds and shorter waiting lists. No one should die waiting on a place to get help. And unfortunately, that does happen. Why care? Because most people who have a substance use disorder also have other related mental and physical health concerns. Even people now in stable recovery need continued access to health care to protect their recovery and stay well enough to avoid relapse. With the proposed cuts to health care, families will be faced with limited options, and the casualties of this epidemic will continue to mount. Why care? Because the heroin epidemic, that according to some has reached pandemic level, truly is a life and death crisis. Why care? Because people you know and love need and deserve it. Thank you.
Ladies and gentlemen, please welcome Sarah McCann.
Hello, everyone. My name is Sarah McCann, and I am a cancer survivor. When I was 13, I sat in my doctor's office, and I heard him speak 5 words that would change my life forever. "I think you have cancer." I was completely blindsided. I said, "Don't people die from that?" And his honest reply was, "Sometimes they do." In a moment, the future became completely uncertain. My thoughts raced. Will I ever get to grow up? Will I ever get to drive a car or get married? And a more teenage concern, am I really going to lose my hair? I did lose my hair. And I also lost a part of my youth that I can never get back. My first year of junior high, I should have been running track. But instead, I spent hours in an infusion chair receiving chemotherapy treatments. Through it all, my parents were there for me. My mom was my rock. I love you, Mom. And they both worked for the state. So thankfully, I had really great insurance to back me up. They were gracious enough to never let me know how much those bills actually totaled to. But after years of treatments and checkups, I was finally deemed cured at age 18. So when I graduated from college in the year 2007, the Great Recession was beginning to rear its ugly head. And so I took my shiny new bachelor's degree, and I went out and I got a job at the mall, at a kiosk. When I got kicked off of my mom's health insurance then at age 26, my company was not able to offer me group coverage, so I had to go it alone and look on the private market. And as I made phone call after phone call, I received rejection after rejection. Some of these companies practically laughed in my face whenever I told them of my previous condition and refused to cover me. Others would quote me astronomically high prices that no one living on a retail manager's salary could afford. So the treatments I received, they really wreaked havoc on my hips. And so my thoughts began racing. I thought, what if I need a new hip? What if I have to get a hip replacement? How will I ever afford that? How will I handle an illness, or if the cancer comes back? Thankfully, a few months later, I landed a job in the Human Resources Department at a large company, and they were able to give me great health coverage. Fast forward 7 years, and today I teach junior high and high school English to some of the best and brightest young people. Thank you. Thank you. Some of the best and brightest young people I know. Hello, if you're watching on Facebook. And I have good health insurance because of that. But if my life has taught me nothing else, it is that at any moment, that security could be taken away. My fear is that if the ACA is repealed, that many of the children that I teach will no longer have health insurance coverage, that many more of my friends and family will die from a growing heroin and opioid epidemic, and that those of us that battled cancer and other illnesses and thought we had won will be told no. The battle is still raging, and we will have to fight again. And this time we will be disarmed and forgotten on that battlefield. So I urge everyone to come together and let's tell our representatives to stop the destructive plan to repeal the ACA. There is more to the cost of health care than dollars and cents. There is a human cost as well. And 22 million uninsured Americans is simply too high a price to pay. Thank you.
Ladies and gentlemen, please welcome Serena Owen.
Good evening, Power Builders. Anyone in here have children in your life that you love? Anyone have seniors in your life who helped you that you love? Know any veterans that you love? Does anyone in here advocate and support our individuals with disabilities and diverse abilities? Well, so do I. My name's Serena Owen, As a parent of children with disabilities and diverse abilities, the wife of a U.S. Marine veteran, an AFL-CIO labor liaison, a youth ministry worker, and a community and state advocate, like you, I strive each day to help not only my family, but others in our community and in our state. So thank you. That's why when there was a threat to dismantle our Kentucky Connect, which was the model health insurance for our nation, I petitioned our governor to help give Kentuckians a voice and a choice for health care. Thanks to Kentucky Voices for Health, labor, a host of allies throughout the state of Kentucky, and Kentuckians for the Commonwealth and other grassroots organizations, we were able to hold our own health care hearings and our own health care forums to make sure that Kentuckians had a voice. We wanted to make sure that our elected officials knew that the ACA is a necessity for working families and all individuals who have that health care insurance, and it saves lives. When the Kentucky Medicaid waivers that my children recertified for were taken away unjustly without due process, our children were left without much-needed health care, without mental health and community-based services, without pain management and other medical services. Their workers lost jobs, our family was more stressed, and as parents we were left without respite, and our children ended up in the emergency rooms, and our daughter was hospitalized for suicidal ideation. When we thought all we had were health care emergencies, more medical bills, a hopeless case, and a prayer, we turned to the ACA. The ACA was a blessing for our family. It saved our children's lives, and my life too, because I was a full-time teacher and I had to take time away from teaching without pay to care for my children with disabilities and my husband, who's a Marine veteran, who also had strokes at the age of 44. So I was able to utilize the ACA as well. This was truly a blessing for our family. As a parent of children with disabilities and the daughter of a senior with disabilities, I'm concerned that the Better Care Reconciliation Act, formerly known as the American Health Care Act, will put at risk expanded Medicaid that helps more than 300,000 Kentuckians with disabilities. The ACA helps loving families like my Northern Kentucky friend whose daughter has multiple severe disabilities and she needs medications and services to live. The ACA helps our seniors. The ACA also helps parents who are taking care of their children with disabilities. It also, the Better, or BCRA, will increase health care costs for our most vulnerable seniors who helped us and now need our help to care for them. It will increase their health care costs and could lose up to 4 million jobs for working families and those already struggling families over 10 years. If our elected officials truly care about improving the quality of our lives and of their constituents, they will help us keep our affordable health care. In closing, everyone deserves a good quality of life. Your voice is valued, and you have power. As power builders, we must and can help our brothers and sisters. We must share our stories and help our brothers and sisters and family members and friends share their stories with our elected officials. We must get engaged in community improvement initiatives. We must vote, and we must hold those in office accountable when they say they care about our quality of life. And we must run for office so we know there are people in power who care about our quality of life. When health care is under attack, what do? When working families are under attack, what do? What do we want? And when do we want it? Thank you, Senator Bernie Sanders. Thank you, Power Builders. God bless you. God bless America.
Ladies and gentlemen, please welcome Amy Stewart.
Hello, everyone. My name is Amy Stewart. I'm the youngest of 6 children of Joan and Frank Stewart. Some of us are here today. My dad, Frank, is 91, and my mom, Joan, is 86. And we are a Medicaid family. I'm here today to speak on behalf of our family, but on behalf of also of so many other families who have loved ones in long-term care facilities who depend on Medicaid for their daily lives. It seems clear to me that from the proposed cuts, many of our representatives in Congress and at the state level simply don't understand how important Medicaid is to the everyday lives of families like ours. My dad is a World War II veteran. He worked in the trucking industry all his life. My mom worked tirelessly to raise the 6 of us and to take care of family. When Dad was about 80, we began to notice that he was showing signs of Alzheimer's dementia. My dad was lucky because my mom was able to take care of him at home for years, even into her own 80s. It exhausted her, but with the help of my siblings and myself, we managed. We were also fortunate to be able to afford some professional in-home care for Dad for a while, but we noticed that his Alzheimer's was becoming too profound for him to safely live at home. We began to look for a long-term care facility in northern Kentucky that we thought could take good care of him. One reputable facility told us that we would need to show cash reserves, financial proof of $180,000 up front, and that would only be sufficient for about 3 years' worth of care for him, if he were to live that long. Most facilities that I spoke to told us that they would charge $5,000 to $7,000 per month cash pay. We were told to apply for Medicaid for Dad quickly because the process takes time. And my family was fortunate in that my parents had some moderate life savings and that they would have to spend down a portion of that savings before he was eligible for Medicaid. I'm grateful to his facility that they were willing to work with us during the interim during my parents' spend down period. I'm also grateful to the Medicaid caseworkers who worked with my family diligently and compassionately during the complex financial process that it took to get him approved. That was 5 years ago, and yes, thankfully my dad is still with us. If they had been forced to pay cash, that would have been $360,000 worth of payments ago. Had our family not been approved for Medicaid, Mom and Dad would have quickly gone broke because their moderate life savings would only have paid for a few months' worth of his care. Had it not been for Medicaid, my mom would have been forced to sell their small cottage to pay for his care, and the proceeds from that sale would have only paid for about 1 year's worth of his care, and she would have been out of her home. As it is today, my dad is well taken care of at 91, and my mom is still in her home at 86 because of Medicaid. But my family's story is not unusual. It's actually a familiar one for thousands of Kentucky families and millions more seniors around the United States who are living longer lives than in years past. 2/3 of nursing home residents depend on Medicaid for their daily lives, their shelter, and their end-of-life dignity. I'm here today to make sure that Mitch McConnell, Rand Paul, Thomas Massey, Matt Bevin, and other elected officials at the state and federal level hear the voices of those people. I'm here to make sure that they understand the hurt that they will cause with these reckless cuts. On behalf of my family and those families, thank you all for being here today, and thank you for raising your voices too.
Ladies and gentlemen, please welcome Lauren and William Wolf.
You have to walk. Here. You have to walk. Okay.
Stand up. Come on, good boy. I'm daddy. You got to stand up for me, okay?
Hi, my name is Lauren Wolf, and this is
William. Mom.
You're doing great, buddy. When I was 12 weeks pregnant with William, my husband and I found out that our pregnancy was in trouble. And when I was 5 months pregnant, we were told I needed surgery, or William was unlikely to survive. And there were no guarantees that me or the baby would survive the surgery or that he would even survive birth with the surgery. And we worried about the effect on our family. As bankruptcy attorneys, we see firsthand how the financial burden of chronic illness can devastate a family financially. William was born, and I got to hold him only for moments until he was quickly transferred to the NICU at Children's Hospital, where he spent the first few months of his life. It was a difficult and scary time for our family. But thankfully, despite the challenges we faced as a family, we quickly learned that with Medicare and Medicaid and the Affordable Care Act, William would receive the treatment he needs and we would not lose our private insurance. And by the time William received a kidney transplant at 18 months, he had been hospitalized 10 times, and there were days we didn't know if he would survive. But we were always able to focus on his health and the needs of our family without worrying about medical bills. And when William received his kidney transplant, he began to grow and thrive. At the time of transplant, he didn't walk and he didn't eat any food by mouth. But he slowly began to eat because he received eating therapy. And he learned how to walk because he received physical therapy. And because he received the medical treatments he's needed, he is a happy, healthy, thriving 5-year-old who will start kindergarten this fall. It's you. Almost. And life with a kidney transplant is not easy. A kidney transplant is not a cure, it's a Band-Aid. And it takes daily care and medicine to keep him healthy. William, you want to tell them about your medicines?
No, you do it.
What kind of medicine do you take for your kidney?
Imuran, I think.
Prograf and Imuran. And what kind of medicine do you take for your bladder?
What's Ditropan.
And what kind of medicine do you take for your heart?
Losartan.
Say it louder. And
Atenolol.
And William, how often do we have to do your catheter?
Every 4 hours.
That's right. And what time do you take your medicine every day?
8:30.
8:30. And how often do you get labs?
Every month.
And why do you get labs?
Because so it can help my blood.
So you can keep your kidney healthy. And he sees a urologist, a nephrologist, and a cardiologist. And sometimes kidney kids get sick and need to sleep in the hospital. And at 5 years old, William has had 19 surgeries. And William will need another kidney someday. But all of this is just part of living with a kidney transplant. And this is what his life will always look like. Yet we are a happy family, and William is blossoming. Because of the Affordable Care Act, Medicare, and Medicaid, we can afford to get William all the medicine and treatment he needs. And because of the Affordable Care Act, when William is an adult, he cannot be denied health insurance because of a pre-existing condition. And I hope our leaders in Washington will think of William and others like him before giving tax breaks to the wealthy and cutting Medicaid coverage and taking away the protections of the Affordable Care Act. Our family story could be your family story. And William is here with me today, and he is alive because of great medical care. And I hope you will stand with me to fight for William and every child with chronic illness, because we are all our brother's keepers. Thank you. Say thank you. Thank you.
Thank you all for being here today. This is live from Covington, Kentucky, and we're just waiting for the next person to get up and speak. More than 250 of you with us today. Thank you so much for being here. Please share this out. Use hashtag #CareNotCuts. I'm sure Bernie Sanders will be up soon. They usually run about 30 minutes and then he comes on. Hey everybody. Hey Springfield, Freethinker, Dewey, Jilly. Absolutely, Stephen. Well, I didn't expect them to be like this. Normally just one after the other. They had this thing down. Somebody must be late. Probably Bernie, outside talking to people. You know how he does that.
We like that back here.
Yes, we do, Laura.
2:44 here. Boy.
Awesome. It's wonderful.
So maybe I can take a minute. People are asking why the signs say, improve, don't destroy. And they're saying, why doesn't it say single payer, et cetera, et cetera. Remember that what we're here to do is to protest the bill that is before Congress right now. We're trying to get GOP candidates and senators to vote against it. That is the point of this. This is not a single payer healthcare rally. That comes next. And just to clarify that.
There you go. Here comes somebody else. Thank you, Laura.
Good afternoon, everyone, and welcome to Covington. And I want to say a special thank you to Charlotte, Serena, Sarah, Amy, Lauren, and especially William for standing up and sharing their stories with you. And thank to all of you in the audience for your passion and your enthusiasm for this important issue. And a special thanks to Senator Sanders for his commitment to fighting for all Americans. Covington is a terrific city, 202 years old, a welcoming, diverse, inclusive, creative community. It's a city of hard-working, striving people struggling to pursue the American dream. And as mayor of this city, I've heard their struggles, their successes, hopes, worries, frustrations, and the priorities of our residents. And health care. Access to quality, affordable health care is near the top of their list. The health care of our nation and our states, the health of our region, our city, and our neighborhoods depends on the health of our people. More than 70 years ago, Franklin Delano Roosevelt called on his second Bill of Rights to promote and ensure the security of this nation. And among those rights is the right to adequate medical care and the opportunity to achieve and enjoy good health. Access to quality health care is essential. It's fundamental for personal and family security. There is a direct line between good health and everything we do. And poor health contributes to every challenge we as a community face, whether it's poverty, crime, addiction, education, or financial security. The health of our state depends on the health of our people. A few years ago, I served in the administration in Frankfort that recognized the Affordable Care Act for what it was, a tool to help Kentucky battle its history of poor health and for Kentuckians to get the quality of health care that they need. We brought health care to over 500,000 Kentuckians. The uninsured rate in Kentucky dropped from over 20% to less than 7%. Kentuckians are getting more preventive care, more cancer screening, cholesterol screening, diabetes monitoring, and flu shots, more health care checkups, better dental care, better care for our children, more substance abuse treatment. The economic impact of the ACA is incredible. Thousands of new jobs for our economy and billions more for Kentucky's hospitals and healthcare providers. And there's less reliance on the emergency room for primary care. We can't afford to betray those people. We can't afford to undermine the state's economy and rip that health coverage back away from them. The health of our region depends on the health of our people. Northern Kentucky and Greater Cincinnati are at the epicenter of the opiate crisis. Heroin is devastating our people. Almost every day we see the impact. Overdoses, car wrecks caused by drivers under the influence, arrests, violence, lost jobs, families in disarray, jail time, prison, and death. Covington's first responders in our town of just over 40,000 people found 638 overdoses in 2016. Over the past 5 years, our hospital saw its emergency room heroin overdoses rise from 252 in 2011 to 1,584 in 2016. Last September alone saw 308 overdoses. The ACA and Medicaid expansion aren't enough to solve this crisis, but they included strong provisions that helped us attack addiction in a more aggressive way. We cannot go backward. We cannot take treatment away from people who desperately need it. The health of our city depends on the health of our people. Covington isn't pretentious. We're full of people who believe that if you get up every day and contribute sweat and effort, your family will be just a little bit better off at the end of that day. You could say that we epitomize America and the pursuit of the American dream. And good health is imperative for the success of our people. But like families in small cities across the nation, we suffered during the recession. Some of us lost jobs in our health coverage through no fault of our own, amid layoffs and downsizing. And some of us have been hurt by the trends in the business world that make health coverage either unavailable or priced out of our reach. We have many neighborhoods where people are struggling to make a go of it in this economy, but our families cannot succeed if our representatives keep undercutting them. Health care should not be a function of the thickness of our wallets. The health of our neighborhoods depends on the health of our people. Too many leaders see health care as a political issue. It's not. It's a people issue. FDR understood that 70 years ago. The challenge on the table today is how to improve the delivery of health care to our families, all of our families, so that everyone has access to health coverage that's both available and affordable. Now, this isn't about partisan battles. This isn't a political scorecard issue. This is a security issue, a life and death issue for our neighbors and our friends. It's a people issue, first and foremost. Well, we do have a friend in Washington. Yeah. He's a friend who understands health care is a people issue. He understands that access to affordable health care is a personal and family security issue. He understands that the health of our community depends on the health of our people. So it's my great honor to introduce to you the Senator from Vermont, the Honorable Bernie Sanders.
Whoa! I didn't know Covington had as many people as I hear tonight. Thank you all very much for coming out. Let me thank Mayor Joe Meyer for that important discussion on understanding that health care is a right, not a privilege. Let me thank the organizations who helped make this event possible, the Kentucky Democratic Party, the Ohio Democratic Party, Kenton County Democratic Party, Our Revolution, Greater Cincinnati, Indivisible 513, and mostly let me thank the people who have been up here speaking about health care from a very, very personal and human perspective. You know, it is not easy for any of us to come before a couple of thousand people, and I think we have a few 100,000 people through live streaming, you know, and to talk about what is personal in our lives. That ain't easy, and health care is very, very personal. So I want to thank the Reverend Damon Lynch for his efforts. I want to thank Sarah McCann and Charlotte Wethington and Amy Stewart and Serena Owen and Lauren Wolf for I am here tonight in Covington for two reasons. First, obviously, I want to talk about this so-called Republican health care bill, which, to my mind, is the worst and most dangerous piece of legislation ever proposed in the modern history of our country. And what bothers me a lot, and the reason that I'm here, and the reason we were in Morgantown, West Virginia earlier today, is that some 50% of the American people don't know what's in this disastrous bill. Tonight we're going to talk about what's in this disastrous bill. So we're going to talk about health care, but I want to talk about something else that troubles me very much. And that has to do with the state of our democracy and representative government, and how it could be that the leader of the U.S. Senate, Senator McConnell of this state, could be working so hard to destroy the Affordable Care Act, legislation, as you have just heard, which has benefited this state more than any other state in America. I don't get it. That I do not understand. And let me be as clear as I can be. This so-called health care bill passed by the House several months ago, strongly supported by President Trump, is the most anti-working class legislation that I have ever seen, and the Senate bill, in many respects, is even worse. Now, I know that when President Trump was running for office, he was here in Kentucky, he was in West Virginia, all over the country. And he was telling the American people that he was going to stand up for the working class. Unfortunately, candidate Trump was not telling the truth. And what I say to the president is, you are not standing up for the working class of Kentucky or America when you throw 22 million people off of the health insurance they have. Brothers and sisters, we are gathered here tonight to make one very, very simple point, and that is we will not allow 22 million Americans to be thrown off of the health insurance they currently have in order to give $500 billion in tax breaks to the top 2% and the insurance companies. We will not support a bill which takes from the most vulnerable people in our country, people who are disabled, people who are sick, people who are elderly, little children. We're not going to take from the most vulnerable in order to make the very rich even richer. That is unconscionable. Now, the reason that I refer to this bill as a so-called health care bill is because it is not a health care bill. A health care bill is an effort to improve health care, not to make it worse. What this legislation is about is nothing more than a massive transfer of wealth from working families to the wealthiest people in this country. While this legislation contains massive cuts to Medicaid, while seniors in Kentucky and around America will pay substantially more for the health care they receive, while Planned Parenthood will be defunded, the 400 highest income taxpayers in America, most of whom are billionaires, will get a $33 billion tax break. That is immoral. That is wrong. Morality and justice is not about taking from those in need in order to give to those who are billionaires. And especially at a time when the working class of this country is struggling and the people on top are doing phenomenally well. It's the working class that needs some help, not the billionaire class. But it is not only the content of this bill, what is in this bill, that is such an embarrassment, but it is the entire process by which this bill has been developed. This bill has been developed in back rooms and in an unprecedented manner. This legislation impacts 1/6 of the American economy. That is over $3 trillion. By its very nature, health care, it impacts every person in this room and every person in this country. Yet the discussions and the negotiations on this legislation, which I can assure you are taking place in Washington behind closed doors right now, those discussions, what's in the bill, how it impacts the American people, has never, ever been made public. Everything has been done behind closed doors. And it is no secret why. The truth is this legislation is such a disaster. They don't want the American people to know what's in it. They want to pass it quickly and then move on with their business. Unbelievably, with legislation that would completely revamp our health care system and the health care that all of you receive, there have been no doctors, no nurses, no hospital administrators, no representatives of senior citizens, no one knowledgeable about the opioid epidemic. Not one of those people, the most knowledgeable people in America about health care, not one of them has been invited to attend a public hearing and to tell us what they think about this legislation. Now, how can you go forward on a bill of enormous consequence without hearing one public discussion from the most knowledgeable people in America about health care? This is a disgrace. Now, I know that there are some people in Kentucky who will say, well, Bernie Sanders is a progressive, a proud progressive. And of course, given his politics, he will disagree with Senator McConnell on this legislation. But what I want to tell all of you and to tell the people of Kentucky, it is not just Bernie Sanders who disagrees with Senator McConnell on this legislation. Far more importantly than what I believe is the fact that virtually every national health care organization disagrees with Senator McConnell and thinks that this legislation is a disaster. It is not Bernie Sanders, it is the AARP, the largest senior group in this country, who disagrees with this legislation because they understand what a disaster it will be for seniors and for older workers. It is the American Medical Association, our doctors, who understand what a disaster this will be in terms of them providing the care that we all need. It is the American Hospital Association that disagrees with this legislation because they fear that if this bill is passed, rural hospitals all over America may be forced to close down. It is the American Cancer Society, the American Heart Association, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Psychiatric Association, the Federation of American Hospitals, the Catholic Health Association, the American Lung Association, the Cystic Fibrosis Association, the March of Dimes, the National MS Society, and the American Nurses Association. So I beg Senator McConnell, listen to the organizations in this country who are in the forefront of medicine who oppose this disastrous bill. Several months ago, as you know, the House of Representatives passed a bill very similar to the Senate bill under consideration right now. And I want to take a minute to describe to you exactly what the House bill does. At a time when 28 million Americans today have no health insurance, and millions more, including many of you, are underinsured with high deductibles and high co-payments, the House bill would throw 23 million Americans off of the health insurance they currently have, including more than 230,000 people right here in the state of Kentucky. How in God's name can anybody think of legislation that would almost double the number of Americans who have no health insurance and throw over 200,000 people in the state off of the health insurance they have? That is beyond comprehension. It is unconscionable, and together we are going to make sure that it does not happen. And here is the irony. Here is the great irony of what is going on in Kentucky. Here in Kentucky, the truth is that no state in America has benefited more from the Affordable Care Act than this state. As the mayor told you, since this legislation was implemented, the uninsured rate for adults in Kentucky has gone from over 20% in 2013 to just over 7% in 2016. That's right. That is the largest reduction in the number of uninsured in the United States of America. Congratulations, Kentucky. Today, in Kentucky, only 4% of your children are uninsured. That's pretty good. This is a significant accomplishment, and the people of Kentucky should be proud of what they have accomplished through this legislation. We should be proud of what Kentucky has accomplished. We should not be in the business of destroying that accomplishment. Now, while Kentucky and many other states have made improvements none greater than Kentucky, the truth, as we all know, is the Affordable Care Act is far from perfect. Premiums in my state of Vermont and around this country are too high. Deductibles are too high. Co-payments are too high. And too many remain uninsured and underinsured. But in each and every one of these very legitimate concerns about the Affordable Care Act, the Republican plan only makes the situation worse. Our job is to improve the Affordable Care Act, not destroy it. Our job is to lower deductibles, lower co-payments, and lower the outrageous cost of prescription drugs in this country. There is something profoundly wrong in America when 1 out of 5 Americans under 65 cannot afford the medicine their doctors prescribe. I just in West Virginia met with a woman whose brother is seriously ill, and the medicine that he takes went up from $100 a month to $900 a month. And you know why? Because the pharmaceutical industry can get away with it, and we have got to stop that. Instead of throwing 23 million Americans off of health care, our job is to join the rest of the industrialized world and guarantee health care to all people. That's all right. And as soon as we defeat this disastrous bill, I will be introducing a Medicare for all single-payer program. Now, what I would like is all of us just to take a moment. I know we've heard from some people who talk from their hearts about what this bill would do. But I want all of us just to take a moment to think about what this disastrous legislation would mean to the lives of your parent, maybe your kid, maybe yourself. What does it mean? Think about it. What does it mean right now if you are suffering with cancer, you're struggling for your life? What does it mean if you have a serious heart condition? What does it mean if you have diabetes? What does it mean if you have any one of a number of life-threatening diseases and you read in the paper that the Republican Congress wants to take away the insurance that is keeping you alive today? What happens to you if you are dealing with a life-threatening disease, if you're in radiation right now, if you're in chemotherapy? What happens to you if your health insurance is taken away and you cannot afford to go to the doctor when you're sick? What happens to you if you cannot afford to buy the medications that keep you alive? What happens if you have no health insurance and you have a heart attack or a stroke, something that happens every day? And the horrible and unspeakable answer is that if this legislation were to pass, many thousands of our fellow Americans will die, and many more will suffer and become much sicker than they should. Now, that is not Bernie Sanders talking. That is what study after study after study shows. A couple of weeks ago, I was on a television show and I made the point that people by the thousands will die if this disastrous legislation were to be passed. And then many Republicans and my right-wing critics jumped up and they said, you know, Bernie Sanders is exaggerating. He's frightening the American people. Well, it's an organization called PolitiFact. And they are a nonpartisan group that checks out what public officials like Bernie Sanders says. And they took a look at over a dozen different studies that looked at the issue of mortality rates and lack of insurance coverage. Now, what does it mean in terms of your mortality if your insurance is taken away from you? And what they concluded is that what I said was well supported. Now, obviously, nobody can predict exactly how many people will die if they lose their coverage. Nobody can make that prediction. But what experts at the Harvard School of Public Health estimate is that if 23 million Americans were to be thrown off the insurance they currently have, which is what the House bill would do, up to 28,000 Americans every single year could die. That is 9 times more than the tragic losses we suffered on 9/11 every single year. In the wealthiest country in the history of the world, we must not allow that to happen. Let me briefly describe to you what happens when you cut Medicaid by over $800 billion over a 10-year period, and by $47 billion here in Kentucky. $47 billion cut over a 10-year period. What it means is that if you are a child with a severe disability, you will no longer get the health care you need to adequately function. An estimated 11 million children, or 15% of all kids in the United States, have special health care needs. They may have conditions such as Down syndrome, cerebral palsy, muscular dystrophy, or autism. They may have mental health needs such as depression or anxiety or complications from a premature birth. Today, Medicaid and CHIP cover 5 million, or 44% of those children, providing them with coverage so that they can live in security and dignity. In this state right here in Kentucky, Medicaid and CHIP cover 40% of all children, including 52% of kids with special health care needs. In addition to standard health care services, Medicaid helps these children get special education at school, long-term care, personal assistance from nurses and attendants, and may cover technology that helps them thrive. If Medicaid is cut, children with special health care needs could be left to fend for themselves. And I say to Senator McConnell and to my Republican colleagues, in America, we don't throw disabled children off of health care to give tax breaks to billionaires. And by the way, it's not just the children who will suffer. Right now, if you are a working class family and suddenly you lose your health insurance, you lose your Medicaid, you're going to have to stay home with that child. How are you going to go out to work? How are you going to make an income? And you will sink into poverty as a result. But this massive cut in Medicaid impacts not only the children, it impacts the elderly. Many people do not know that 2/3 of nursing home care is paid for by Medicaid. People don't know that. So if you make drastic cuts in Medicaid, what happens to the people in nursing homes? Where are they going to go? Are they going to be thrown out on the street? Are they going to be taken to the basement of their kids? Are their kids now going to be forced with having to make the choice of taking care of their mom with Alzheimer's or having the money available to send their kids to college? In America, we should not have to make those choices. But it is not just nursing home care that's going to be impacted. Donald Trump told the American people when he campaigned that he was going to be a friend of the working class. Well, if you are a worker in Kenton County, Kentucky, who is 60 years old and you make $40,000 a year, if this legislation is passed, your average health insurance premiums will go up from roughly $4,000 a year to more than $7,000 a year. That is not being a friend of working people. At a time when half of older Americans, people 55 and older, have no retirement savings as they approach retirement, what does it mean to your life if your health care costs are going to double? That is not what we do to people who have worked their entire lives. They have a right to retire with dignity. But once again, this is not Bernie Sanders talking. Listen to what the AARP has to say about this horrific piece of legislation just a couple of weeks ago. Quote, "This new Senate bill was crafted in secrecy, behind closed doors, without a single hearing or open debate, and it shows. The Senate bill would hit millions of Americans with higher costs and result in less coverage for them." Quote, "AARP is adamantly opposed to the age tax, which would allow insurance companies to charge older Americans 5 times more for coverage than everyone else." But it's not just the kids who are going to be hit, and it's not just older workers or senior citizens. Let me say a word about an issue that is incredibly painful for my state of Vermont, for our country, and is also very difficult here in the state of Kentucky. And that is the opioid and heroin epidemic that we are seeing from coast to coast. And I know that I don't have to tell anyone here in a community that has been hard hit by heroin and opioids about the devastating impact these killer drugs are having on the people in your state or my state or people all across this country. Each and every day, more than 90 people in our country die from an opioid overdose. Nearly 4,000 people begin abusing prescription painkillers, and almost 600 every day start using heroin. This is a national crisis. According to the Center for Disease Control and Prevention, Kentucky's opioid drug overdose death rate is the 3rd highest in the nation and more than twice the national average. In 2015, over 1,300 people here in Kentucky died from drug overdoses. That's about 4 people each and every day. That same year, over 350 million opioid painkillers were distributed in the state, enough to provide every man, woman, and child in Kentucky with nearly 80 pills. In northern Kentucky, almost 5 times as many lives are lost as a result of drug overdoses than car accidents. In a 2015 poll from the Foundation for a Healthy Kentucky, about 1 out of every 3 people in northern Kentucky said they knew someone who had a problem with heroin. Now, what do you think is going to happen to our ability to treat addiction? What do you think is going to happen to our ability to prevent addiction if massive cuts are made in Medicaid? Our job is to expand funding for the opioid crisis, not to cut it. If you cut Medicaid by over $800 billion nationally over a 10-year period, it will mean that up to 15,000 people in Kentucky would not get the treatment they desperately need to treat their addiction. Furthermore, this is not just about opioid addiction. It's not about kids. It's not about the elderly. I hear every day on the floor of the Senate my Republican colleagues telling us they believe in freedom, they believe in choice, they want you to have any insurance policies you want. 2.5 million women have chosen Planned Parenthood. $2.5 million women have chosen Planned Parenthood as their source as to where they want to get their health care. And what the Republican bill would do is defund Planned Parenthood, which could mean that Planned Parenthood health centers in Lexington, Louisville, and Cincinnati could be forced to close, leaving over 3,200 patients without the care they desperately need. Unacceptable. Let me take a moment to put another human face on what this bill will mean to so many people. You know, as a United States Senator from Vermont, I get emails every day and phone calls and letters from people in my state, and in fact throughout the country, about many issues, including this issue. I want to just read to you a few excerpts from some of these letters to tell you what people in America are worried about today. This is from a mother who wrote to me, and I quote, "My adult son has Down syndrome. He can barely get by with what few Medicaid services are available now. Please don't punish my son for needing these services." End of quote. She's right. We should not be punishing people with Down syndrome. And here's one from a father who writes, and I quote, "Trump Care will allow insurance companies to deny health insurance to people with pre-existing conditions. In my family, this could disqualify my son born with a defective heart valve who must have costly open heart transplant surgery to get a new valve every 10 to 14 years. Another letter. I am 38 years of age, I am well educated, and I had a great job. But I developed chronic migraine. I am so disabled, I can no longer work. I just qualified for Medicaid. It will be my lifeline as I fight daily pain and other debilitating symptoms. If this bill passes, I fear that it will become a choice between draining my family's financial resources, even facing bankruptcy, so that I can continue to access the limited medical treatments I have that help my condition. Another letter. I am a psychologist. Most of my patients, many of them dealing with the experiences of autism, trauma, eating disorders, and/or anxiety, can only receive services because they are covered by health insurance. This disastrous bill could allow insurance companies to deny coverage for mental health diagnoses, making it very difficult for the bulk of my patients to access services that they need. My friends, this legislation that we're talking about today is not what the American people want. Poll after poll shows overwhelming opposition to this bill. According to the latest USA Today Suffolk University poll, just 12% of the American people support the Senate Republican plan. 12%. As a matter of fact, according to a recent report, this piece of legislation is the most unpopular bill presented in Congress in the last 3 decades. It is even more unpopular than the $700 billion bailout of Wall Street. All of which leads us to a very simple question, which is the second point that I want to make this evening, above and beyond health care. Why is legislation being aggressively pushed that the American people don't want, and at the same time will do enormous damage to the Senate Republican leader's very own state? How does that happen? And we should think about that. How does that happen? How does it happen that a bill might be passed which is overwhelmingly opposed by the American people? And the answer goes to something which is even deeper and more serious than this horrific legislation and the overall health care crisis we face as a nation. The answer as to why this legislation is being pushed is that increasingly government does not listen to or represent the needs of ordinary Americans. Especially since the passage of the disastrous Citizens United Supreme Court case. You are familiar with Citizens United. And as a result of that case, what you're seeing now are billionaires pouring hundreds and hundreds and hundreds of millions of dollars into the political process. So what you have right now is ordinary Americans saying, what, are you nuts? Of course we don't support legislation that would throw us off health care in order to give tax breaks to billionaires. But Congress is not listening to the disabled children, to the elderly, to the working class of this country. Congress is listening to wealthy campaign contributors. And what those contributors are saying is, yeah, we're billionaires, but it is not enough. We want even more. We want massive tax breaks. And so what if 22, 23 million people are thrown off of health insurance? So what if elderly workers in Vermont or Kentucky have to pay double for the health care they need? So what if disabled children are left on their own without any health insurance? So what? We are billionaires, and we want it all. And today, what we are saying to Senator McConnell and the billionaire class, you can't have it all. We're not going to let you. Everybody understands, everybody here, and I want the people of Kentucky to understand what's going on in our country today, but you all instinctively understand it. You know that for 40 years under Democratic administrations and Republican administrations, we have seen the middle class of this country shrink. We have seen people forced to work 2 or 3 jobs, 50, 60, 70 hours a week in order to take care of their families. Meanwhile, during the same period of time, the very wealthiest people are becoming wealthier, and today we have the absurd situation where we have the top 0.1% now owning as much wealth as the bottom 90%. When you have people working, when mom works, dad works, the kids work, 52% of all new income is going to the top 1%. And here is a very simple proposition. And that is, when you have people in this state and in my state working incredible hours, you don't take away their health care in order to give tax breaks to people who are already phenomenally rich. That is immoral, that is un-American, and that is unacceptable. Now, our job today and in the next several weeks is to do everything that we can to defeat this terrible piece of legislation which will harm so many people. That's our job today. Our job tomorrow is to join with every other major country on earth to guarantee health care to all people as a right, not a privilege, to a Medicare for all single-payer program. And our job every day, today, tomorrow, and the next day, is to fight for a political revolution which demands that we become a vibrant democracy where politicians listen to the people and not the billionaire class. Let me conclude by saying this. And that is that a great nation is not judged by the number of billionaires it has or by the size of the tax breaks they receive. A great nation, a truly great nation, is judged by its commitment to justice, dignity, and equality. A great nation is judged by its compassion, by how it treats the most vulnerable within our society, the children, the elderly, the sick, the disabled, the poor. That is how we judge a great nation. The bill currently in the United States Senate, is a moral outrage, and together we will defeat it. Thank you all very much.
This land is your land, this land is my land, from the California to the New York Island, from the Redwood Forest to the Gulf Stream waters. I said this land was made for you and me. Listen up. Now I went walking to a great big wall there, and on a sign it said, healthcare from the GOP, but on the other side, it just said Bernie! Yes, sir! Now that side was made for you and me. One more time. This land is your land. This land is my land. From the California to the New York Island, from the Redwood Forest to the Gulf Stream waters. I said this land was made for you and me. There it is.
Thank you, bro.
Bernie Sanders. Yeah, that was awesome. Dewey, I see you saying it felt like a campaign speech. Okay.
Yeah.
So you get practice early. That works for me. You guys, you're killing me. Thank you so much. I can't even
All
add
the
that
super
much.
chat money. I know I lost count.
I know, it's incredible. Thank you all so much. Can you tell it's a little hot in here? I'm going to put all this money towards the air conditioning fund. If we're going to have to run through the rest of summer with Bernie Sanders on tour. Yeah, yeah. But no, that was we saw him honing this speech over the last month or so, right? And it's really getting there. He's really a lot stronger. It really calls he's tougher on, you know. This isn't a campaign speech in the sense that I don't think he would be this. No, maybe he would at this point, but he wasn't this harsh when he was running for office before, you know.
Yeah.
But anyway,
he really got it. He really went into depth. I mean, his speeches, last month were more introductory, supporting someone else. He talked for at least half an hour, almost 40 minutes.
Yeah. I think it's half hour, 40 minutes is what he actually does.
So that was
pretty intense.
That was worth the price of admission.
Yes,
I think.
Was. You guys are awesome. Thank you so much. I will tell you this. Google does this weird thing with holding of the funds. I think we're now over a tipping point on the funds where it'll actually disperse, which is nice. And thank you guys. The super chat thing has been building up for a while. All of you who have donated into super chat before, and I think maybe now you put it over the Google will finally send me something. So I appreciate that. Thank you very much. That was huge. That's Bernie brings the ratings
Yeah. and the viewers. Wow.
And the viewers.
Over
Thank you all.
300 still.
Yeah, 300 of you. Thank you all for being here. And as you learn
And
about,
don't go. We've got more.
we do. Well, we have, what? Just the tune?
Song.
Yeah, we have the song. We're gonna go out with a song, but
before the song goes.
And thank you all. It's a big crowd here. Really nice. Thank you for dropping the Patreon. I appreciate that. We've got things coming up I want to talk about, though. All right, we have this Wednesday. Join us on We the People, 7 p.m. Pacific. Paula Jean Swearingen. She's running against Joe Manchin. And we're going to talk with her, find out what's going on, how her campaign's going, and what she needs to do to get that guy out of office. He's certainly not interested. He voted. He was a Republican. He's just a Republican. I don't know what he's doing in there. He's not even an establishment Democrat. He's just a Republican. Somehow got elected as a Democrat. He's like, hey, this is lucky. Look at me. I think he snuck in. He was just trying to do it. If you ever want to know if you can do it, there you go. Be like Joe Manchin. Just go on a GOP side. Take it over. Thank you, Melissa H. Jim West. No, you would never see this speech on MSNBC. They'll run a clip and they'll take it out of context because they'll say Bernie Sanders says that Congress, caters to the billionaire class, and he's talking of all of Congress, and that's very nice. That's not very nice. They'll do something like that. They'll find somebody to make it bad. You know how they are. Anyway, so we got that on Wednesday, and then on the 15th, Scott Galindez brings us a live stream with our Live View solo unit, and we're working together with the folks over there at Iowa CCI, Citizens for Community Action, and Bernie Sanders is going to be there. And we'll be talking about health care. We'll be talking about, because I always got issues, They got a lot of issues. They got environmental issues, and those environmental issues have caused health issues. And then they have the fact that they're a Republican-run state. And so the Republicans don't care. And they've been repealing laws with regard to water and pesticides and all these things. And residents have poisoned wells, and there's poisoned waterways. It's not good. Maybe we can get, maybe we can get Tom Fegan to join us for that. Laura, see if he can come on, talk for.
Oh, yeah. Well, he can. He's just not available on Wednesdays.
No. It's just Saturday, I think.
Yeah. Oh, yeah. No, he's going to be there. I'm sorry. I was.
Oh, he's going to be there. Of course he is.
Yeah, he's going to be there. I've already talked to him about finding Scott and giving some perspectives while he's there. So he's down for that.
Good. Excellent. All right. Wonderful. Thank you all. Brent, I'm going to go through. This will show me. I should be able to see donations and names again because it shows me in the chat, but I should be able to find it later, and I will reach out to you all and thank you so much. That's really cool. And yeah, see us Tuesday for Awake with John and Marcus and whoever else happens to show up. We got Dennis that hangs out now, and Katie is going to show up on. I don't know what day. Katie, you were in the audience. I don't know what day you're going to show up and talk about Brexit.
Wednesday was the day that she was.
Wednesday? Okay. Wednesdays you can talk about Brexit. It looks like Jeremy Corbyn might end up. He's the British Bernie, right? He might end up taking over because they're going to have. Looks like they have another election, and Theresa May, right? It's like female Trump. Almost not that bad.
He's getting support right and left.
Yes, exactly. Globally, the people's movement is gaining support, right? The people are tired of it. It's an amazing thing, and I know we've got people who have watched this from around the world, and we'll watch it later around the world, like crazy German Dennis. I don't know what time it is over there, Dennis, but it's late, and you need to go to bed right now.
It's 1:45 in the morning, and he just said he's going to bed.
Good, get out of here, go to bed. You've got things to do. And Cynical Girl, nice to see you again. Thanks for being here. Libby Weed, it's been a while. Rob Bell, how are you? Wacky Fours, nice to see you all. Good. All right, Laura, any other things we want to talk about? Things I'm forgetting?
We mentioned We the People this week, and then next week is Alexandria Ocasio from New York.
Right.
Do
we want to look at our list?
She's cool. Yeah, I get my calendar up right here. So Alex, and then after that, Jeff Erdman from Minnesota, and then on August 2nd, Topher Brennan from California. On August 9th, Dorothy Gask from Washington, and we've got several other people lined up for the rest of August. So we're almost booked through August. You see that list? That's Laura Leibengood right there, folks. Yeah. Doing all that work, setting them up, book them, Laura. I say. Well, you know what? It's not a hard sell. When I show them the shows we've done already, and say, look, this is who we've interviewed already. This is who we've got lined up. Are you available for an hour on a Wednesday night? It's not a big ask. And it's a great way for us to see all kinds of different candidates. It is. So we'll keep you posted on new ones as we can.
Thank you, Laura. And if you're new to this channel or returning to this channel, which used to be Bernie 2016 TV, this was one of 5. I think it's 2 or 3. This we just renamed it Uphill Media, and we're still doing what we do. Broadcasting Bernie, covering special events, especially things going on in Iowa. And we've got weekly shows, Pseudo Intellectuals, which is every other week. So not this Sunday, which is today. Next week we'll have another episode. And they talk about serious stuff using bigly words and try to help us understand what's going on. Don, if you're watching, you should check it out. It might help you with a lot of things. We're also working on a show with Sandy Shalas, pardon me, who is Environmental Coffee House. I don't know if you've seen her on Facebook, but she does a great climate series, and we're producing a show with her right now. So I'm very excited about that. Thank you all for being here, being a part of the audience, being a part of the volunteer group. If you're helping in Slack, if you're helping on the channel, whatever you're doing, thank you, because you make all of us want to stay here together. It's all a group thing, right? It's like water tension. We're all doing this and helping each other and cheerleading each other and motivating each other. Then we stay here and we gel and we move forward. And we have to work hard every day at doing that. We're going to go out with a song that is it's an old song. I say old. It's because it's late 90s. I think it's late 90s, early 2000s. I remember when it's Drive, Incubus. I'm an Incubus fan. But this song didn't really have the meaning to me that it does now, thinking about what we're going through with our government, with the world, the 99% versus the 1%, literally, first definition, good versus evil. I don't know how else you can define it. It's pretty much good versus evil is the battle we're in to save our lives and our planet. It is the best movie ever, except that we're in that movie and we decide how the script goes, if we really want to. But that's the point of the song, Drive. Am I ready to take the wheel, get in a car and drive? Listen to all the words. This is a video. This one has all the words on it. Just read the words. You'll be like, oh, shit, wow, that fits. That fits a lot. That really fits. Wow, that fit. That was the whole thing I did for this. It's like it all fits right now. We, the people of the world, if you're awake, it's time to get behind the wheel and drive. We control our government. We control how we want to live as citizens of this planet, not the greedy few. It's going to take a lot of effort. But I'm ready to drive. We'll see y'all Tuesday.